Welcome everyone, Dylan Gemelli here today with a brand new video for you, and today we're going to talk about the side effects associated with MK677, also known as Nutrobal. Now remember, I am not a doctor, I am not telling you to use any of these things, I'm not advocating it, none of the above. Anything you do with this information is strictly on you. This is for entertainment purposes only, information that I have picked up over the years through study, experiences, etc. So, let's talk about some side effects associated with MK677. There's a few to go over here. Now, the most frequent or common side effects are going to be the appetite increase and possible water retention. These aren't the only ones, but I'm going to focus on these first. Now, the increase in appetite is good for some people and bad for another. It's kind of an anomaly here because MK677 has a high affinity for burning fat and fat loss, but it's very difficult, especially in those early stages, because the appetite increase for some is extremely drastic. It can be worse than smoking 3 joints and being hungry all night. I mean, it's like that. It's one of those things that it's very, very strong and potent. A lot of people go to MK677 that are struggling to have any sort of appetite whatsoever. So keep in mind that it does generally pass that extreme hunger, but it can take 4 to 6 weeks. Some people more or less. Those are general numbers. I've seen some people say that they haven't really had it at all, and some people have had it last for a few months where it's just so drastic. And then you kind of get used to it and it kind of subsides. But you can normally expect with that first 3 to 4 weeks where you're going to have a substantial increase in hunger. Some people that are dosing it at night will say they wake up in the middle of the night to eat because they're so hungry, while some people dose it at night because it helps enhance their sleep. So the hunger is one aspect of it. Now, water retention is another. And that generally happens within the first month and normally subsides. Now, a lot of the reason this happens is because you must control your sodium to potassium ratio. See, one thing people don't understand is that you need 4,700 milligrams per day of potassium, just as your normal daily value, and you're only supposed to be at 2,300 milligrams per day of sodium. A lot of people don't get anywhere near the potassium they need and go way over their sodium needs or necessities for the day. You don't want to overdo it on potassium, but you want to hit that 4,700 mark, and you want to keep your sodium at 2,300 or a little bit below. I'm not saying that's going to totally eliminate your water, because it's just one of those things that does occur with MK677, but that definitely helps to mitigate it and to control it before it passes. And you might want to take something like dandelion root, which is a natural diuretic, which is just going to help kind of flush more water out. You know, it's not something crazy, but it does definitely help. Make sure you sit in the sauna a little bit or steam room and just try to sweat a little more, and drink plenty of water as well. There are several studies out there that report an increase in fasting blood glucose and a decrease in insulin sensitivity. And these side effects are similar to those observed in people with elevated growth hormone levels, mainly joint pain and insulin resistance. If you've got diabetes or anything like that, don't take MK677. Or if you're, prone to it, maybe reconsider it. Just don't do it. It's not smart. It's not a good thing. Although most studies out there report little or no side effects, there was one study that was terminated because of some pretty bad events. There were elderly patients that they were testing with hip fractures, and MK677 actually elevated their blood pressure and their blood glucose levels, and there were cases of congestive heart failure. Now, the patients experiencing it were over 80, and they already had a history of prior heart failure. There's never been anything on normal, healthy adults taking this. And there's a lot of studies. You can go to PubMed. They go all the way back to the late 90s, 97, 98, 99 even. They've been studying 677. And generally, all of the studies are extremely promising. This was a one-case scenario with obviously a control group that had a history. But I've got to point it out because it did occur. But you also have to keep all the facts in there and realize, the situations. It would be prudent to watch your carbohydrate intake and regularly check blood sugar and insulin levels while you're taking 677. Don't cut your carbs too low. I would always recommend at least keeping them moderate. It should be avoided if you have cancer. Both growth hormone and IGF-1 could possibly promote cancer growth, and just knowing that, I just wouldn't do it. All right? if you're Th1 dominant, since growth hormone has, immune stimulatory properties, I wouldn't take it either. Now, another thing to note with the sleep. MK677 does improve your sleep, but some people, when they dose it before bed, for whatever reason, it negatively affects their sleep. Yet some people do it, and it really enhances their sleep. So if you find that it bothers you to take it at night, take it in the morning. All right, and keep it away from when you're sleeping. I can't tell you. I have no idea. I've always thought all these years, I know that to take it this time, and then I was like, no, take it this time, and it just comes down to the person. All right, I flip-flop myself because I've seen so many things happen each way. So it's just trial and error when it comes to that. I can't tell you the answer to that, and really nobody can, or they shouldn't, because there is no answer that's 100%. That is the only answer is trial and error. So those are the main side effects with 677. They're not drastic, but you've got to know about them. You've got to know side effects on anything that you ever use. It's a must to protect yourself. So, that being said, www.icearms.com/forums. I'm also in the Evolutionary Forum as well as the Elite Fitness Forum. Dylan@icearms.com is my email, so you send me all your questions and comments. Please make sure to check the descriptions below. I've got all my social media links. You can find my old videos, all my information, so please read those and please subscribe to the channel. That being said, stay tuned for plenty more to come. Dylan Gemelli, signing off.